in just a couple minutes. My colleague King will hop on and get us started in just about 2 more minutes while we allow some other folks to join on. Nice to see everyone.
Good morning, everyone. My name is King, and I am the Community Engagement Coordinator here with the Department of Public Health. And I just want to take a second just to thank everyone for joining our respiratory health webinar today. So today we'll have simultaneous interpretations. To participate in the session in another language, please press the globe icon on the bottom of your screen, then choose which language you would like to use. First and foremost, we'd like to give a big thanks to all of our interpreters who are assisting us with today's presentation. Today's training will be available in ASL, Vietnamese, Mandarin, Arabic, Spanish, and also Haitian Creole. This session will also be recorded and uploaded to YouTube, so anyone who couldn't attend this session can still get the information needed. The recording link will also be sent out in a follow-up email along with the presentation slides at a later date for anyone who wasn't able to attend today. So during this presentation, if any of you have questions throughout the session, please type them in the question and answer box of the chat below. We'll also answer all questions at the end, or we'll type the answers back to you during today's presentation. If you are calling in and your questions are not answered, you can call us at 215-685-5488, or you can always email us at publichealthpreparedness@phila.gov. Thanks to everyone from the health department here to answer and help questions. And so today, we will discuss the respiratory viruses most common in Philadelphia this season. Um, we'll be discussing the respiratory virus most common in the Philadelphia season, this season. Then we'll discuss the big three respiratory viruses, what they are, how they spread, and how you can keep your community safe. Lastly, we'll discuss the updated vaccines and where to get them for free. We hope this presentation has useful information, so please do let us know any suggestions you may have for how we can improve our presentation for future attendees. Now we're going to be passing over the presentation to Jasmine, where she'll talk to you guys about what the big three respiratory viruses are.
Good morning, everyone. Thank you again for joining us. We will begin discussing the three big respiratory viruses that are spreading this fall. We may all know them. We have influenza, also known as the flu, SARS-CoV-2, also known as COVID-19, and respiratory syncytial virus, abbreviated as RSV. We will go over ways these viruses are similar and different in the coming slides, as well as what you can do to protect yourself and your community. Seasonal flu or influenza is a common respiratory infection that affects the nose, throat, and sometimes the lungs. Flu season runs from October through April, and flu vaccines are updated every year to protect against the most common or dangerous strains that season. The best time to get vaccinated is in September or October. Earlier in the season, the better, because then you are protected the entire season. It is still helpful to get vaccinated later in the season if you have not yet. Like we are coming up on November. It's still very important and recommended to get vaccinated, even if you have not done so yet, since the respiratory virus season can last all the way through late April, even early May. Everyone 6 months and older should get a flu vaccine each year. The vaccine cannot give you the flu, and side effects are usually mild, like arm soreness, headache, or fatigue. Any side effects from the flu typically go away on their own in just a few days. And getting vaccinated is helpful to protect you from severe illness and helps prevent spreading it to others who may get very, very sick from the flu. You can get flu vaccines at your doctor's office, pharmacies, and the city health centers that we will discuss a little bit later. My colleague Maria has put a link in the chat where you can learn more information. COVID is the one that has been talked about recently for a very long time. Um, it is caused by the SARS-CoV-2 virus. It usually affects the upper respiratory system, but can lead to serious illness in some people. Since 2019, the virus has changed many times, also known as mutated. These are called variants. As the virus mutates or changes, vaccines are updated to protect against newer strains, just like the flu shot. Everyone 6 months and older is eligible for an updated COVID vaccine, and it is recommended. Staying up to date is especially important for people at higher risk of severe illness or hospitalization or death from the COVID virus. This can include adults 65 years and older, people with underlying medical conditions, young children who have not been vaccinated, and people who are pregnant, postpartum, or lactating. Again, you can learn more at the link that was posted in the chat. RSV, or respiratory syncytial virus, is a common respiratory virus. Most people only get mild cold-like symptoms like a runny nose, cough, or sore throat. However, RSV can be serious for certain groups, especially infants and older adults. In older adults, RSV can sometimes lead to more serious problems like pneumonia, worsening asthma or COPD, which is chronic obstructive pulmonary disease, heart issues such as congestive heart failure as well. The good news is there is a vaccine for older adults that helps prevent against severe RSV illness. So, who should get protected from RSV? All adults 75 years of age and older, adults 50 and older who are at increased risk of severe RSV illness, pregnant people in order to protect their babies and newborns, and infants under 8 months of age whose birthing parents did not receive the RSV vaccine while pregnant. These infants can get a one dose of RSV monoclonal antibodies, which is a lot of words, just to say that it's an antibody that helps protect them in their first RSV season. RSV vaccination or antibody protection is a one-time deal, not annually like flu or COVID shots. So if you've already had the RSV shot, you don't need to get it again. There are many common symptoms between flu, RSV, and COVID-19 and the common cold. Um, all of these things can look the exact same and can range from symptoms, no symptoms at all, mild symptoms, or even severe symptoms. These symptoms include, I just said it symptoms quite a bit. These symptoms include fever, chills, fatigue, cough, and headache, and many other common symptoms as well, like shortness of breath, headache, sore throat. Testing is needed to see if you have COVID, the flu, or RSV, or possibly all three. Combination flu and COVID tests are available at the city resource hubs. We will provide details later in this presentation on those resource hubs. It's important to note the landscape of public health information is changing right now, and it can be challenging to find trusted information. So, we want to promote good quality sources for public health information so that you and the people around you can protect yourselves and your loved ones. Some important pages on the CDC's website may not be updated for this year as of yet. So, we have a few options for you. First, finding a trusted primary care provider is important in staying healthy, especially during respiratory virus season. You can find you or someone you know can find a trusted primary care doctor with our primary care finder. This can have free, low cost primary care providers that may even speak your language. We will go over this in greater detail later. We have a network that sends newsletters directly from us at the Public Health Preparedness Program on the most up to date and important public health information. This is on our Community Response Partner Network. You can sign up at this link in order to receive newsletters from us. Lastly, we recommend searching the Philadelphia Department of Public Health's website at this link, phila.gov. The health department is constantly reviewing federal guidance and will continue to make local recommendations to keep Philadelphians healthy. I will turn it over to my colleague Maria, who will discuss how respiratory viruses spread.
Thank you, Jasmine. Okay, so before we get into this section, we're going to start off with a poll question. It should pop up on your screen momentarily, and I will go ahead and read the question to you all now. So the question asks, which strategy will not prevent the spread of respiratory viruses? And your options are hand washing, immunizations, cooking food to the recommended temperature, and staying home if you are sick. So we'll give folks about a minute to answer, and then we will reveal the answer. I see a lot of correct answers coming through right now, which is great. So again, key here is which strategy will not prevent the spread of respiratory viruses. Okay, great engagement so far. I really appreciate so many people answering the question. A few more seconds, and then we will check. Right. So 87% of folks answered correctly. This is great. Thank you guys. So the correct answer is cooking food to the recommended temperature. So that is great to prevent foodborne illnesses, but it is not going to prevent respiratory illnesses. So instead, you're going to want to wash your hands, stay up to date on your immunizations, stay home if you are sick. And these are the ways that are going to reduce your risk of respiratory viruses. Right. So, Jasmine spoke about flu, COVID, and RSV, and now we're going to talk about how they all spread in similar ways. So, primarily through the air, when an infected person coughs, sneezes, or talks, and another person inhales those particles, or those particles come into direct contact with a person's eyes, nose, or mouth. Sometimes by touching contaminated objects or surfaces and then touching your face, you can also get it this way. And people can spread the virus before they even know that they're sick, since they may not even have symptoms. This is called asymptomatic spread. So the spread of viruses by folks that have asymptomatic virus is one reason why it's important to wear a mask in crowded public spaces, because we do not know if they are sick. They may not even know that they are sick. So, have you noticed that more people get sick in the fall and winter? So, I'm sure a lot of you know that it's obviously colder. You're going to want to be inside more. You don't want to stay outside when it's cold. The holidays are also clustered around this time, so you might be gathering inside more with friends and family members. So, there's an increase in respiratory virus transmission during this time, again, because more people are gathered indoors because of the cold. More folks are traveling and gathering for the holidays, and colder, drier air also helps viruses spread more easily. So, you want to make sure that you discuss your vaccine eligibility with your healthcare provider to protect yourself and also your loved ones throughout the holidays and colder months. So, when we did this presentation last time, I said that this was kind of like a gift, a holiday gift to the people around you. So, if you can get vaccinated, you're helping yourself and your community. So, all three viruses are spread in the same way, and many of those precautions to help protect against them are also the same. So, the best ways to protect yourself and others are staying up to date on your vaccines, washing your hands often, staying home when you are sick, talking with your doctor when needed, and keeping fresh air flowing indoors. So keep that fresh air circulating, crack a window for a couple of minutes if you have to. And if you have HEPA filters, that's great. So other tools like masking or testing can be helpful in certain situations. So if there's a lot of illness going on in your community, so if a lot of people are sick at work, if a lot of your household members are sick, if a lot of your community at your senior center or in your school are sick, you're going to want a mask and take a test. If you are recently exposed or just recovered from being sick, take a mask and test. Again, these are just extra precautions that can really help. Or if you or someone you know is at higher risk for severe illness. So we'll talk more about these groups of folks that are at more risk momentarily. But some examples include if you are going to be around a elderly family member, for example, and you've just recovered from being sick, or you should take a test. Also, if you're starting to cough, you have some of those symptoms, sneezing, and you're going to visit or be around someone who's at high risk. So every layer of protection helps. Even these small steps make a difference, and better safe than sorry. So now we'll get into the folks that are at serious risk for illness. So again, you'll want to take those extra precautions if you're going to be around anyone that falls into these categories. So seasonal flu, RSV, and COVID can affect people differently. People that are at higher risk for experiencing severe complications due to these viruses include older adults, so typically seniors. Seniors make up the vast majority of hospitalizations. People with underlying medical conditions or weakened immune systems. So let's think about heart disease, cancer, diabetes, high blood pressure, HIV, respiratory diseases such as asthma, chronic obstructive pulmonary disease, lung cancer, and more. Recently pregnant folks and currently pregnant, infants and children, and people who have not been vaccinated. So, anyone in these categories experiencing any sickness should reach out to their doctor. It's very important to be aware of the options that are available to you for severe illness. It's also important that people living with or taking care of people that fall into these categories also protect themselves from getting sick and passing on illness. Some other factors that impact our risk for severe illness include social and environmental factors. So, people whose jobs and living environments expose them to respiratory illness need to take extra care during the colder months. So, think about nurses or home health aides who are visiting people that might be sick, people with less access to medical care, lack of access to healthy food, and people who live in neighborhoods with poor air quality. So these all have increased risk of serious illness. And this list doesn't include everything, but this, along with the groups previously mentioned, so someone, for example, could have a lack of access to medical care and also have cancer or heart disease. So just think about the overlapping. You could fall into two categories here, which again increases your risk for severe illness. Okay, so next we'll discuss what to do if you are exposed to one of these respiratory viruses and get sick. So, if you've been exposed to a respiratory virus, the first step is to keep an eye on how you're feeling, monitor your symptoms for the next week or two, watch for any symptoms. You might want to jot them down in a journal or on your calendar, or maybe a post it on the fridge, and take extra precautions during this time. Again, reach out to your doctor, let them know the date things started as they progressed, and then you could have a really good line of communication with your healthcare provider this way. If you have any questions, especially if you're someone who falls into one of those high risk categories for serious illness, make sure you reach out to your doctor. Again, it's very important and always better to check in early. And while you're monitoring your symptoms, you can jot down dates and how you're feeling and be able to tell them exactly what's going on. So taking these steps not only protects you, but also the people around you. So the people in your community, at work, where you eat, live, pray, all that. So just think about the community at large. So since flu, COVID, and RSV all look the same, you can't tell which one you have just by your symptoms. The only way to know for sure which one is to test. So at-home combination tests are available at our local resource hubs. These tests check for flu A, flu B, and COVID. If you're feeling sick, testing helps you figure out your treatment options, especially if you're at high risk for severe illness. So, again, think about those categories we mentioned a little while ago. And also, if you're feeling sick, you reach out to your doctor, take a test, find out if you have something, and you can start treatment. I had symptoms of COVID or respiratory illness a couple of years ago. I took a test that same day, came back positive for COVID. I sent my doctor a My Chart message immediately detailing when things started. I was prescribed Paxlovid. started that immediately. And I would say by the second day, I was feeling better already. So, early treatment is key, and communication with your doctor. So the health department recommends testing for COVID if you have symptoms or you're going to be around someone who could be very sick. So if you have a cough, you're sneezing, and you're going to visit someone elderly, or if you're going to go to church with a large community, you want to make sure you take a test. So even if you test positive without symptoms, you can still spread the virus. Still contact your doctor and take extra precautions for at least 5 days. And the bottom line and final message we want to make sure that you take away from this small section of this big presentation is that you cannot guess which virus you have. You have to test to know. And you can pick up your free flu and COVID combo test at your nearest resource hub. We will provide links for all of that in the chat. And you can go in there anytime that they're open and grab free tests. So this at-home COVID flu test looks similar to the regular COVID test. So again, this is testing for COVID, flu A, flu B. They look very similar to the test from last year, but you can see the black font right there under FlowFlex tells you what it's testing for. And then they'll give you some information so that you can interpret your results. So again, at our resource hubs, they are free. So, what to do if you're sick? So, the most important takeaway this season is that if you are sick with any respiratory symptoms, stay home. Stay home and stay away from others. You don't want to spread this. Help contain it. Do your due diligence in your community and household, and just stay away from everyone. If you're at higher risk, so if you fall into one of those categories because of age or health conditions, or if you're exposed and have been exposed, contact your doctor right away. Again, I know many institutions use MyChart where you can send a message to your doctor and receive a response within 24 hours, sometimes sooner. Please utilize this. Definitely want to make sure your doctor knows so that you can start treatment if you're eligible for that. So you can return to your regular activities once your symptoms are clearly improving and you've had no fever for 24 hours without taking a fever reducing medicine. So once you're back in public, keep protecting others for the next 5 days. So wear a mask, keep your distance, and keep circulating air at home for 5 days afterwards. Again, I know it's cold and opening the window right now sounds not that not that nice to do, especially on a day like today, but you can just crack it a little bit to get some circulation. The more precautions you take, the better for everyone. So most people can manage their respiratory illnesses at home, again, by resting, staying hydrated, and taking medicine as needed. Even people with mild illness may need to be prescribed antiviral medications by their doctor. These work best when started early, so contact your healthcare provider as soon as your symptoms begin. Again, exactly what I did a few years ago, and I probably saved myself a trip to the doctor or the ER. So it's important to speak with your doctor about the best treatment plan for you, even when deciding which over-the-counter medications are best. So I know a lot of us might go into a CVS or Walgreens and grab everything in the cold and flu aisle when we're not feeling well, but you really need to be careful because I have hypertension, for example, and I cannot get the regular cough syrup. So check in with your doctor, check in with the pharmacist if one is available, and make sure the over-the-counter stuff is good for you as well. So when to seek emergency medical attention, excuse me. So some concerning symptoms when you are sick, you want to be on the lookout for and call 911 if you or anyone in your household, your community, has these symptoms. Difficulty breathing, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, difficulty waking up, seizures, dehydration or not drinking enough, not urinating, severe muscle pain or weakness, fever or cough that improves but then returns and gets worse, worsening symptoms of chronic medical conditions, So, for example, if I'm sick and I notice that my blood pressure is higher than normal, that is worsening of a chronic medical condition already. Again, falling into one of those categories, this is the time to contact your doctor. If you have a fever above 104 Fahrenheit or 100.4 Fahrenheit in babies younger than 12 weeks. So these are all reasons to call 911. And again, better safe than sorry. Okay, so I will close out my section before turning it over with one other poll. And our question here is 95% of all hospitalized for COVID-19 in the US are not up to date on their vaccines. So again, key word here is not. 95% of all folks hospitalized for COVID-19 are not up to date on their vaccines. I will give you guys a few more seconds to answer. Oh, perfect. Everyone answered already. 91% of you got it right. Amazing. So correct. So this is why it's important to stay up to date on your vaccines every year. Anything that's recommended, I would say get it. You're helping yourself, your family members, your the students at your school, the senior center members, your coworkers. So just think about yourself and everyone else. So I would turn things back over to Jasmine, and she will go into respiratory illness and chronic health conditions.
Thank you, Maria. That was some very informative sections. Now we will focus on how respiratory illnesses can affect people with chronic health conditions and what to do if this is relevant for you or your family. People with certain chronic health conditions are at risk of complications from respiratory viruses. Viruses can worsen symptoms of pre existing conditions, and in some cases, they can lead to new complications. In fact, during recent flu seasons, 9 out of 10 people hospitalized with flu had at least one underlying health condition. That is a lot of people. That's 90%. People with lung disease who are sick from respiratory viruses are at greater risk of developing secondary infections as well, such as pneumonia, for example. It is important to discuss your chronic health conditions with your doctor and ensure you are prepared for respiratory virus season. So, if you fall into any of these categories, or you or someone you know does have any of these concerning underlying conditions, such as diabetes, heart disease, kidney disease, liver disease, or respiratory diseases such as asthma or COPD, then you want to make sure you're taking extra precautions to save yourself from hospitalization or severe illness. In order to prepare for the respiratory virus season, you can take several steps. First, you want to talk with your healthcare provider about your personal risk factors and create a care plan for fall and winter. You want to know ahead of time where you can access testing and treatments if you get sick. I see that there were a lot of questions about this in the chat, and we will go over even more detail in our resource section next up. You can stay up to date on your vaccinations like the flu and COVID shots and RSV if you're eligible for that. You want to continue taking your medications exactly as prescribed for your chronic health condition. So you don't want to alter your medications unless this was something that was discussed with your healthcare provider directly. You don't want worsening chronic health condition symptoms on top of a respiratory illness if you were to catch one. You also want to manage stress management, having good rest, healthy routines, and a self care plan can all make a big difference if you were to get sick. And finally, you want to put together an emergency supply kit. This should include at least 2 weeks of medication, extra food and water, basic supplies, and an updated list of your emergency contacts. Having an emergency supply kit is helpful in case of evacuation or some other natural thing in the world that could happen, especially with at winter storms and things like that where you can have power outages. So you want to be prepared, especially if you have underlying conditions. And like Maria stated multiple times in her sections, you want to prevent illness with good hygiene, washing your hands, avoiding touching your face, keeping distance if you are sick, and keeping distance from people who are sick, especially if you have a chronic health condition. So now, even with all of that preparation ahead of the season, sick days can still happen, and it's important to have a plan for if you were to get sick. You want to keep at home testing kits available so you can check quickly if your illnesses might be something like COVID or flu. So that combo test will come in handy. Knowing which illness you have helps you plan the best treatment with your doctor. I know for me personally, my mom has a respiratory condition that makes her especially susceptible to getting sick with COVID or the flu, and then that turning into pneumonia. Again, the risk of severe illness with chronic health conditions is higher. So, for someone like my mom, she wants to make sure she has that testing kit at home so that she can know if she's sick with the cold or with the flu, cold, or COVID, and then she can talk with her doctor. That'll make her care plan go much smoother. Secondly, you can monitor your health closely. You want to watch for worsening symptoms of your chronic health conditions and watch for new symptoms of the respiratory illness that you may be suffering from. And take notes of that, like Maria stated. Take those notes to your doctor and let them know exactly what's going on so you can have the best treatment plan, especially if you need antiviral medications. You want to talk with your doctor ahead of time about a sick day plan should you get sick. That can include what fluids and foods to eat. So we say drink a lot of fluids and eat healthy food and eat soup. But you want to make sure, especially if you have diabetes or something like that, that your sick day includes foods and fluids that you are able to ingest without making yourself worse. Your sick day plan can also or should also include whether or not your medications need to be adjusted. Again, talking about that with your doctor and which over the counter medications are safe for you to take with your chronic health condition. Like Maria stated, we love to go into the aisles, grab all the cold and flu stuff we can get, and see what works. But you want to make sure you're taking the necessary steps, especially if you're on other medications. And most importantly, know when it's time to call your doctor or seek that emergency medical care. If you have those really bad symptoms like shortness of breath, seizures, or anything that Maria discussed, you want to make sure you know what is bad for you and when to call your doctor or go to the emergency department or call 911. By being prepared ahead of time and having a plan for if you were to get sick, you'll be better equipped to stay safe and manage your health this season. So, just to wrap up all of this information that you have heard so far before we go into resource section, we'll go over some key takeaways. So, like all vaccines, the flu vaccine, COVID vaccine, and RSV immunizations are designed to help protect people against severe disease, hospitalization, and death. This is why you want to get vaccinated. It does not prevent the illness or prevent you from catching the illness, but it prevents you from being severely ill. It is safe to get all three of your vaccines at the same time if you're eligible for them. So if you want to do a one-stop shop, that'll make sure you got everything you need and don't miss out on anything. For any specific questions, please speak to your healthcare provider. Learn more about your seasonal vaccine eligibility. And if you don't have a primary care provider or someone in your life doesn't, then follow up on our primary care finder to find one. So you want to protect against all big three respiratory illnesses, flu, COVID, and RSV by immunizing, We can't state it enough. Staying home if you are sick and seek treatment if needed. Testing if you are sick to know exactly what you're dealing with. And you want to protect yourself, of course, but you want to protect those in your community as well, your loved ones, especially ahead of the holiday seasons. We're all about to gather in a few weeks to eat some yummy food, hopefully. So you want to make sure you're staying safe with good hygiene, and making sure you have your vaccinations. If you have health insurance, you want to make an appointment with your doctor to get your vaccines, or you can visit a pharmacy for free or low cost vaccinations at the pharmacy. If someone or you don't have health insurance or are underinsured, you can visit the local health centers. You want to call ahead to ensure availability. You can get vaccinations at the health centers. You don't need to be a registered patient. But you do need to have Philadelphia residency. So bringing your license or a piece of mail to show residency can get you a vaccine at these health centers. And then also, of course, finding a primary care provider that is free, low cost, and available to you to help you get the care you needed. So I will end with another question for you all, a poll. So seasonal or yearly vaccines are not important because viruses do not change. Is this true or false? LOL at the question. Yeah, exactly. We make it so funny so that it sticks into your brain. False, exactly. I've seen a lot of falses. This is great. Perfect. Thank you all for answering. You are correct. This is completely false. Vaccines are important because they do change, and we want to be protected against the newest strain or the most dangerous strain that season. So I'll turn it over to King, my colleague, who will go over all the resources that you have been patiently waiting for.
Okay, so now we're going to jump right into discussing some of the resources that the city will be offering this fall. The first resource that we'll discuss are the free at-home COVID test kits. So the PDPH has resource hubs around the city of Philadelphia that distribute at-home test kits, and they provide many other resources. As you can see above, they provide HIV test kits, harm reduction supplies, safe sleep classes, and the list goes on. But basically, they offer all these different types of services. And the good thing about this is that with the use of these services, no insurance or IDs are required to visit any of these resource hubs. To visit one of the resource hubs, to locate one of the resource hubs, essentially all you'd have to do is click on the link below to see the hours of operations and the locations that are closest to you. So essentially you don't have to go a further distance if one is located in your area. All right, another resource available are the low-cost vaccines. Free and low-cost vaccines are offered for people without insurance and are available at health centers around the city. But one thing we like to tell individuals is please be sure to remind community members to call the health centers in advance. Just to make sure that they have whatever vaccine you're looking to get, right? So we're not wasting a trip going to these health centers and not being able to get the vaccine that we were looking for, right? And just to see the most up-to-date locations and hours of operations, and again, which locations are near you, like I previously stated about the other resource, essentially all you'd have to do is click on the link above, and it will show you the locations and the hours of operations. All right. In addition to the two resources we spoke about, we also have the PDPH call center. The PDPH call center will answer any questions you may have about COVID-19 testing site information, resources, and places to get vaccinated. They can also provide vaccine record requests, public health guidance, and other information. The hours of operation are usually Monday through Friday from 8:30 a.m. to 5 p.m. Interpretation in other language are also offered. The number is listed above for you all. All you would simply have to do is press 2 for Spanish and then 3 for other languages. All right. So everyone has a doctor or primary care provider they trust. It is important to have a primary care provider to answer questions and concerns, especially times of public health information uncertainty. Like for myself, with me, when it comes to finding a primary care provider that I felt like resided with me essentially. It took me a very long time for me to find a primary care provider that I felt like when I went to go visit them, that I wasn't sitting in the waiting room for like 20 minutes, right? And only spending 5 to 10 minutes with my actual primary care provider. After finally finding somebody that I was comfortable with, this is literally my primary care provider who I've been sticking with for a couple of years now. And why? Because I feel like they care about what I have to say. I feel like they're willing and they want to provide aid in situations when I need them. And they're obviously here to just provide some assistance altogether, right? And we want to feel like we're being cared about when we go see our primary doctors, right? So we like to remind everyone that it is okay to switch primary care doctors until you find one that fits your needs and makes it comfortable for you. A primary care can help people stay healthy. They can help treat any health problems that arise. Contacting a primary care physician when someone is experiencing any health concerns or if they have questions about their health or public health guidance is essential. This website lets members search for providers by things like location, by languages offered. It is designed specifically for people who are uninsured or underserved and need free or low cost medical care. All right. So essentially, this is our fall preparedness material orders. You can order print and copies of the materials in multiple languages at the link you see on the screen on the newsletter, which is the bit.ly link. One good thing about this is when you request these materials, they are free. They will be printed in color and can be delivered to your address, or you can pick them up if that is preferred. This is the perfect way to ensure you have the most up-to-date materials to hand out to your community members and coworkers as needed. So as we gear up for the winter, we want to make sure that your network is connected with utility resources, right? So neighborhood energy centers is a great way to learn about weatherizing your homes and understanding bills, but also connecting you to additional assistance and resources available. So if this is something that interests you, you can always go to the website or scan the QR code on the screen above. And it will provide you with the locations, which ones are closest to you or closest to a friend if you are providing this resource to someone you know, the hours of operations and the services that are provided. Next, we have the Utility Emergency Service Fund. So this helps stabilize housings for families facing a housing crisis by addressing their immediate needs and removing their barriers to long-term stability. And for this service, their hours of operation are usually Monday through Friday, 8 a.m. to 5 p.m. I would always give a call just to make sure that those hours of operation are the most up-to-date hours available or offered. And you can also visit their website to learn more about the information or scan the QR code for a contact form. All right. Next we have is the Bennett Philly, which it offers one-on-one support to connect residents with non-income based benefits. And base the non-income based benefits can consist of things just like prescription drugs, health insurance, food, paying for college, and the list goes on as you guys can see in front of us. And then last but not least, mental health and well-being are very important. So if you or someone you know is experiencing a mental health crisis, please provide them with the number of 215-685-6440. Interpretation is also available for these services and it is available 24/7. Another good resource is the National Suicide Prevention Hotline, which we like to call the 911 hotline because this number is 988. So this is a number we do like to tell individuals to remember because it's easy, it's short, and if someone is going through something, we always want a solution for these individuals. So that number again would be 988. This is easy to remember. This is an easy to remember number, and this also provides 24/7 access to services for individuals who need it. Or for free online behavioral health screening and resources, you can always visit Healthy Minds Philly at philly.org. And a newsletter with mental health and wellness resources will be provided in the follow-up email for you all. All right. So last but not least, to stay connected with us and everything that you learned today, you can always email us at publichealthpreparedness@philip.gov, or if you prefer to speak with someone on the phone, because you're someone who likes to talk on the phone preferably, you can always give us a call also at 215-429-3016. And just some last minute takeaways: stay up to date with most of the materials that are being offered within the public health department, like I previously stated. um, Through the newsletter, you can click on the bit.ly where we can provide you guys the most up-to-date materials that we are providing to community members. And again, they will be printed, they will be offered in color, and you guys can choose to either have these materials mailed to your home address, or you can come pick them up from our centralized home. Something else we like to tell individuals to stress, which I feel like we didn't really get to touch upon, is just making sure individuals sign up for Ready Philadelphia text messages. Why? These are very important because it keeps you up to date with what's going on in the Philadelphia area. And if you want to make it more specific, you can make it more, you can specify it to your specific general area. So if you're in North Philadelphia and you just want to know what's happening in North Philadelphia, we can specify that. But it's just a good way just to keep up with what's going on in the city. And then last but not least, just joining our community partner response. This will provide you with the most up-to-date information on things that are happening within the Philadelphia Department of Public Health. And why not know what's going on within the Department of Public Health? Because this is what's going on in our city and it can also affect us. And thank you guys for your time. I hope you guys enjoyed this presentation, and I'm just going to send it back to Jasmine for last minute thoughts.
Thank you, King. As always, the resource section is the most popular. We appreciate everyone taking the time out today to be here with us. And we hope that you guys stay healthy, stay safe, especially as the holiday season comes up, and share this information with everyone you know.